Hey everyone, welcome back to my channel. My name is Kelly. I am a physical therapist as well as a certified lymphedema therapist. Today in this video, I'm going to go through a full routine for manual lymphatic drainage or lymphatic drainage massage to the right leg. Lymphatic drainage is used as a technique to get fluid moving out of a congested area such as in the right leg. Lymphatic drainage can be used for lymphedema, lipedema, vascular issues, or just lymphatic health in general. I'm going to be doing this routine laying down with my legs up on the bolster or up in the area. Anytime we're using some sort of gravity, that's going to assist in getting the fluid moving up and out of the area. But if someone has to do this in sitting, you can modify that way just fine. I have created a lot of other videos on lymphatic drainage as well as other components of complete decongestive therapy, which you can check out on my channel, and also be sure to subscribe down below to see when other videos related to that come out. You can also follow along with us on Instagram for more related content. Lastly, before we begin, make sure that you check with your doctor for safety clearance and check with your certified lymphedema therapist for more personalized guidance. Lastly, before we begin, make sure that you check with your doctor for safety clearance and check with your certified lymphedema therapist for more personalized guidance. Okay, so the first thing we want to do is stimulate the lymph nodes in the tummy or the abdomen area. You have a lot of lymph nodes in your abdomen, and all the fluid has to go through the leg, through the abdomen to get back up towards the heart. And so if this area is congested, this fluid is not going to move through. And so what we'll do, think of the abdomen in 4 sections. We're going to do belly breath. So we're going to put our hand in one of those sections. We're going to take a nice big breath, feeling your belly expand into your hand, but give some resistance. So breath in and out. Move to the next one and breath in and out. Third section, breath in and out. Fourth section, breath in and out. Good. We also want to stimulate the lymph nodes in the rest of the body that will be used to get the fluid moving through the lymphatic system. So we do have lymph nodes that sit around the clavicle or the collarbone as well as behind the ears. So if we use our whole hand, putting it right on that clavicle or collarbone, and we're going to do nice large circles right in that area. We're going to do about 8 to 10. And then we're going to do the same thing on the other side. So right below the collarbone or clavicle. And after we've stimulated those lymph nodes, we want to go to the ones that are right below the ear. So hands on either side and nice big circles. After we've stimulated the head and neck lymph nodes, then we want to think about the right lymphatics. So you have lymph nodes that are right in this groin area. All the fluid from the leg have to go through these to get out. But if these are compromised or there is congestion here, we want to try to get the fluid moving away to healthier lymph nodes. So that means either on the left groin area, if someone does not have lymphedema or swelling on the left, or to the right armpit area, the axillary lymph nodes. So we want to stimulate those lymph nodes as well. So hand right on the crease where you would sit on the left side, and we're going to do large circles there. 8 to 10. And everything directly on the skin if able. After we've done those, we're going to take our whole hand, put it right in the armpit on the right side, and we're going to do large circles there. 8 to 10. After that, we're going to go towards the right groin area where the lymph nodes are that we're going to work on. Same spot right where the crease is, directly on the skin if able, and we're going to do 8 to 10 circles to stimulate those lymph nodes to help speed up the process of the lymphatic system. And after we've done that, we want to try to get the fluid moving out of this area. If this area is backed up and we're trying to move the fluid out of the leg, then this has nowhere to go. So we want to try to clear this. So if someone does not have a compromised left leg, we're going to work on strokes from the right groin to the left, across. We're going to go 3 to 5 times across or more if someone would like, working some of this fluid away. And after we've done that, we're going to work from the right inguinal nodes or the groin nodes to the armpit. The vessels run on the side of the body. So if you can reach all the way over, and we're going to work up the side of the body in small strokes towards the right armpit. 3 to 5 times, or 3 to 5 strokes all the way up, doing short strokes against the skin. And then after we've done that, we're going to work now towards this right leg. So if someone is able to roll on their side, what we're going to do is work from the fluid from the bottom or the glute or the low back area towards the front. So the vessels run from the back around towards the front. And so if someone is able to reach, we're going to work in strokes from the back and the glute area around towards the front. I know some individuals will not be able to reach that, but then you can just skip this part or just reach as far as you can. And after we've done 3 to 5, or as much as someone needs, you can go back onto the back. And we're going to work our way down the leg. So we want to work into sections. So think of the thigh area, the knee, the lower leg, and then the foot and the toes. We're going to start at the top, work our way down, and then we'll work our way back up. The reason we don't start from the toes and just work our way up is because, again, if this is congested and it's blocked, we start to hear that fluid can't move up. And so we need to decongest or unblock this area, work our way down, and then we'll work our way back up. So thinking from the knee towards the hip, we want to think about the front, inside, back, and the outside. And we're going to use our whole hand, and we're going to work in strokes, small strokes. Give a little skin stretch as you go to stimulate the vessels to get the fluid moving, help with the valves. And we're going to do 3 to 5 strokes down in each area. So after we've done the front 3 to 5, we're going to work on the inside, and I'm going to work on the outside at the same time. The vessels start to wrap around a little bit towards the front. Everything has to come into the front, and so as you get closer, you're trying to think about moving towards the front as you go. Now, if you hit an area that is what we call fibrotic with fibrosis, which is thicker, harder tissue because fluid has been there a while and can harden it, then we can stop there and do a little bit of deeper work. And so if I think about gently kneading dough, grabbing the tissue, just gently rolling through it, massaging through it, we're working to soften this tissue. Because if it is hardened and thickened, the fluid and the lymphatics are going to get even further blocked. So we want to soften it, break up some of that fibrosis, spending a couple minutes there or more as needed. And then after we've done that to any area, then we want to make sure we go back and finish with those strokes down. So finding and stopping along this as much as you need to hit all of those areas. And then I'm going to go around the back, same thing. We do want to start to wrap around towards the front because this is the way the vessels run. 3 to 5 times, making sure we're getting all areas of the thigh with as much surface area of our hand as possible. And spend more time in an area that you may need. So after we've done the full thigh area or upper leg, we're going to go towards the knee. So you have some lymph nodes right behind your knee, and so we're going to do some small circles right behind the knee to stimulate those lymph nodes. You can also work kind of around. There are tendons back there that you might be able to feel. You want to work your fingers around the tendons because fluid likes to sit around there, or some people get kind of that fibrotic tissue around there. And then we also want to work in front of the knee, working around the kneecap and around the other bones. The fluid likes to sit into those crevices as well. So using your hands and your fingers to get into those areas. After we've worked through the knee, we're going to go to the lower leg, so from the ankle to the knee. Same thing, we're going to think of the front, the inside, back, and outside, 3 to 5 on each side, small strokes, all the way up. If someone can hold their leg up for gravity, you can do that, or maybe you have a higher bolster, or if someone is working on a family member or a friend, if they can have the leg up and you work on them in that position, that is ideal. But either way, it's going to be helpful. So I'm going to work on the inside and the outside at the same time. Three to 5 times. Short strokes all the way up. And then after we've done the inside and the outside, we want to make sure we work in the back. This is a really common area also to get some of that fibrotic or hardened tissue. So if we hit an area, what we'll do is just gently stop and massage through that to soften it. Spending a couple minutes or whatever someone would like. Once we've worked and really softened that area that might be harder, we want to go back and finish with those small strokes. After we've done the whole lower leg, then we want to work into the foot and the toes. So I'm going to work on the top of the foot. And then we also want to make sure that we get around the bones. So your malleoli bones are the inside or the outside that stick out. Fluid likes to sit around that for a lot of individuals. So we want to make sure that we're using our fingers to work around those bones. And then of course through the tendons of the top of the foot. And then through the top of the toes. If someone has little to no swelling on their toes, they can do all the toes at the same time. Some individuals will need to do each toe separately. So if someone has more time, that is more thorough, work through each toe by itself. And so after we've made our way all the way down the leg, we're going to go in reverse. And so we've worked to decongest the whole leg down, and now we're going to work to move that fluid back up. So you've made it to the toes, so now we're going to go back to the foot, working around those tendons, and also working around those bones. 3 to 5 times, or as much as you'd like. Then we're going to work towards that lower leg. So still thinking about front, inside, outside, and back. 3 to 5 times with the short strokes all the way up. I'm going to go inside and outside at the same time. If it's too much, just do one at a time, depending on what position you can get into. And after we've done 3 to 5 there, I'm going to work back into the back of the leg. And maybe you'll stop and try to work to soften that fibrotic tissue again. And after we've done the full lower leg, we're going to go back to the knee area. So working around the bones of the knee, working around the kneecap, also working behind the knee, getting around those tendons. And then once we've done that, we're going to go back to the upper leg. So working from the knee to the hip, we're going to start in front and work downwards. or upwards, depending on if you're sitting upright. But stopping to work on any harder fibrotic tissue. I'm going to work to the sides. And remember, start to work towards the front as you get going towards the hip. Directing towards the lymph nodes in the front. And after 3 to 5 times, we're going to work in the back of the leg next. Kind of working from the inside around towards the front. Good, and after we've gone through the full lower leg, we can try to go back to the side of the hip if you're able to reach, working around towards the front, working from the low back to work around, wherever you may have backed up swelling. And after we've made our way back towards the hip, all the way back to the lymph nodes, we don't want the fluid to stay sitting around there. We want to make sure we're moving it out of this area. And so we're going to go back, and so I'm going to work across from the right hip to the left. Again, if someone has left leg swelling, you will skip this part. And what we'll do for everyone, unless there's right arm involvement, is to go from the right hip to the right armpit. So trying to reach to the side of the body, working in strokes all the way up towards the armpit. Again, like I've said, directly on the skin is best. Three to 5 times. And then after we've made our way all the way back, we're going to finish with deep belly breath. So still thinking about the 4 sections. We're going to do that belly breath. Feel your belly expand into your hand. Give that resistance. So big breath in and out. Next section, breath in and out. Breath in and out. Last one, big breath in and out. And that's the full routine. I hope you all found this video helpful. Again, if you're looking for lymphatic drainage to other parts of the body, make sure that you check out my channel because I have a lot of other videos related to this. And then subscribe down below to see when other further videos come out. And I'll see you all next week for another video. Thanks, everyone.